This is my assessment of the shoulder joint, and before we go into the shoulder joint, we've managed to get consent from Niall, both verbal and written. So when I start doing the shoulder joint assessment, what we start off with observation, and what we're looking for is any deformity between the left and right side. So we start off with the clavicle seem to be in right position. We look at the pecs, they seem to be fine. We're looking at the trapezius, upper fibers, they seem to be fine. We're looking at the shape of the deltoids, that's fine. We're also looking for any visible scars that there might be for previous surgery, there's no issues there. Any bruising from any injury that he may have sustained, that's fine. We're also looking for any rashes in and around that area, and that seems to be fine. Now, can you now turn your sideways on, please? We're also going to look from the side to have a look at his left and right shoulder position, and we'll just feel for the acromion and where the head of the humerus is sitting. There should be 1/3 and 2/3. That seems to be fine on that side. We'll just check on the other side, and that seems to be fine. Can I turn to your backs to me, please, now? And whilst we've got him at his back, we're looking at upper fibers of trapezius, that's fine. Middle fibers of trapezius, that's fine. Rhomboids we're okay with. The angle, medial border of the scapula, that seems to be fine. We're looking at muscle bulk, it's even on the legs, that's okay. But also looking for a straight spine through the thoracic and lumbar region, so there's no kyphosis or scoliosis, and I'm happy with that. Now can I turn you around again? Before we go any further, we need to make sure the cervical spine is clear. So now, can I get you to look over your left shoulder, please, as far as you can? Any pain there at all?
No.
Look over your right shoulder. Any pain there at all?
No.
Okay. Look up. Any issues there?
No.
And look down. Any issues there?
No.
Take your left ear towards your left shoulder, please. And your right ear towards your right shoulder. And we're just looking for evenness of movement, and that seems to be fine. Now, can I just sit you on there?
Yeah.
And we're just going to do a couple of final tests just to clear cervical spine. So now I'm just going to get you to look over your right shoulder. Just take it down, and you tell me if you get any pain or numbness down the arms or tingling. That's fine. We're just going to take your left, turn you over, and then push down again. Any pain or problems there?
No.
So I'm quite happy that the cervical spine is clear. So we now move on to palpation. Can I lay you on your back, please, now? So what I'll do is I'll start off by palpating the sternoclavicular joint. Any pain at all anyway, just let me know. And I'm going across the clavicle into the acromioclavicular joint. That seems to be fine. I'm just going to go into the subacromial space. No pain there at all. That's fine. I'm just going to come into the coracoid process, just where the long head of the biceps attaches. Any pain there at all?
No.
Okay. So I'm now going to drop into the biceps sulcus. Any pain into there? No. That's fine. I'm just going to roll that arm over and just bring it into play the greater tuberosity, and I'm just going to go into the greater tuberosity. Any pain there?
No.
So I'm just looking for supraspinatus, infraspinatus and teres minor. I'm good there. I'm just going to go into the pec tendon, and I'm happy with that. Can I turn you over onto your tummy now, please?
Yeah.
And hands down by your side, very comfortable. So once I've got him in this position, I'm just going to make extra sure that his cervical spine is clear. Any pain into any of that?
No.
Okay. And I'm just going to go into the thoracic spine. Just make sure all the thoracic spine vertebrae are all fine. And we're good with that now?
Yeah.
Okay. So I'm going to find the medial border of the scapula. I'm just following that round. Any pain there?
No.
I'm just going to find the spine of scapula. Any pain into there at all?
No.
I'm palpating for supraspinatus. Any issues there?
No.
Okay. Can I just bring you on to, just going onto your forearms like so. I'm just going to come into the back of his shoulder and feel for infraspinatus muscle belly and tendon, that's fine, and teres, and again that's fine. Any pain there at all?
No.
Just come up a little bit higher. That's fine. Any pain into there?
No.
That's fine. So I'm happy with my palpation. There's no challenges there. I will now go on to doing range of movement, active range of movement. Now can I have you standing there, please? So we'll first check flexion. So what I'd like you to do now is take your arms up all the way up if you can. And back down again. And take your arms back. Any problems there at all? Okay. And turn to your backs to me. Okay. Take your arms up your back, just checking for medial rotation, just measuring and looking at muscle bulk, that's fine. And now bring your arms down your back. Any issues there at all? Okay, and then arms down by your side again. And can you take them out and then all the way up? Any issues there at all?
No.
Okay, and back down again. Okay, and just turn and face me again. So I'm just going to test for muscle strength now. Can you just take your arms out to the front of you? Don't let me push down. Don't let me push in. Don't let me push out. Okay, and down by your side. Don't let me push in. Keep it there, keep it there, keep it there. Don't let me push out. Okay, that's fine. And just take your arm out behind you, right arm behind you. Don't let me push in. That's fine. And same on the other side. Don't let me push in. So muscle strength is all fine, as is active range of movement. I just want to check for passive range of movement now. Now, can I just get you laying on your back, please? Just laying flat. Okay. What I want to do is I just want to bring the arm out. I'm just going to gently turn it out. Turn range. And turn it back in. Any pain there at all?
No.
Okay. And just from there, I'm just going to bring your arm out. Okay. And that's fine. So I'm happy with his passive range of movement, his active range of movement, and his muscle strength. So now I'm going to go do some specific testing for shoulder, so shoulder rotator impingement. Now be standing up again. So the first test that I'm going to do is a NIAS test to check for impingement in the shoulder. And I'm just going to stabilise the acromion and the scapula, internally rotate his arm and bring that up. And you tell me if you feel any pain anyway.
No.
No pain there at all. So I'm happy with that. So I'm just going to do a Hawkins-Kennedy test. Any pain or discomfort there?
Yeah.
Just a little bit discomfort there. Okay, I'll just check that against the opposite side. Any problems there?
No.
No, okay, so, and I'm just going to do an empty can test now. So what I want you to do is take your arms out in front of you, just to the side of 30 degrees, thumbs facing up initially. Any pain there at all? Okay, can you turn your thumbs down? Don't let me push down. Any pain or discomfort there?
No.
That's fine. So 3 tests for impingement are all negative. I'm just going to check for a slap tear now. So we're going to do an O'Brien's test. So what I want you to do is bring your arm up, take it in front of you and then turn your arm down, okay? Okay, and then take it down. And don't let me push down now. Any pain there at all?
Yeah, slightly.
Slight discomfort, okay?
Yeah.
Just ease off. Any pain there at all? So slight pain there, so we're just going to go on to do a different test and we'll just do a crank test. Any pain there at all?
No.
Any pain or clicking in there at all?
No.
I can't feel anything. Any discomfort there at all?
No.
Okay, that's fine. What I want you to do now is just check for the acromion, AC joint. So we're going to do a scarf test. Can I get you to do take your arm around there and then just push back with as hard as you can. Any issues there at all? No problem. So we're quite happy with the AC joint. I'm just going to check for the bicep now. Just raise your arm up straight, please, and don't let me push down. Any pain or discomfort there? Okay, just lower it down slightly. Any pain there? No issues. So I'm just going to check for subscapularis now. Can you just get your arm facing your tummy now? And then pull in if you can. Any discomfort there at all?
No.
Okay, I'd like you to take your arm behind you now and just raise it off your back and Don't let me push. Any pain or discomfort there?
Just discomfort.
Just a slight discomfort. Can we just check that against the other side? Don't let me push. Any problems there at all? So just a slight discomfort on subscapularis. Once I've done that, we're just going to be looking for signs of shoulder or scapular dyskinesia. So what I'd like you to do now is just push your shoulders blades back together and then forwards, okay? So just facing, just squeeze your shoulder blades together. And what we're looking for is any alignment there, that's fine. And take your shoulder blades forward. Any issues there at all? No. Take your shoulders up and then drop them down. Any issues there at all?
No.
Now, can you put your hands on your hips now? And we're going to repeat that. Squeeze your shoulder blades together. And we're just looking for the medial borders. That's fine. We're looking at the upper fibers of traps. That's fine. And control. Now, can you push forward? Draw them forward. Any issues there at all? We're still seeing the symmetry. That's fine. And take the arms up. Symmetry is good. And push down. Any issues there at all?
No.
That's fine. Take your arms down in front of you. And we'll repeat. Square shoulder blades together. And forward. Okay, up. And back down again. And now, can we repeat that? Just taking your arms up all the way up, okay? Okay. And slowly bring them back down again. Okay, and bring them down. And forward. Okay, and down. That's fine. And drop your arms. Okay. So we've looked at scapular dyskinesia now, and I'm just going to check. Can we just get you against that wall? And I want you to do a press up against that wall. Yeah. So what I'd like you to do from there, just go down again, and I'm just going to resist that slightly and push up. So we're having a look to see if there's any winging of the scapula, any upward rotation, but that's all fine. So before we finish off now, if you step away, we just want to do some functional testing and look in the kinetic chain. So what I'd like you to do now, so if we face that way again, is just stand on your right leg and just squat down and back up. And what we're looking, can you do that 3 times? And we're looking for hip control, knee control, and that's fine. And then same on the other side. Again, we're looking at knee control, hip control, and that's fine. Before I finish off then, I will go on to do some functional testing and do some provocative tests to see if I can create any more irritation if there is a problem. And that's my assessment of the shoulder joint. Thank you.